You're missing a tooth. Yep, you are. So what do you do? I'm Dr. Zev Kaufman. Let's explore a very common, probably the most common, mode of replacing a missing tooth: the bridge. Up to the ubiquitous incorporation of implants in our daily practice, the bridge between two teeth to replace a missing tooth was probably the most common way of doing it in fixed prosthodontics. Let's have a look here. Seemingly a fully restored mouth, but this patient actually is missing two teeth right over here. As you can see, these two teeth are present, and then there's two teeth here that are missing. And we actually make a bridge to restore that space. So what's the problem, you say? Well, if you speak to people that have a bridge, they will tell you, I hate my bridge. I keep getting food and stuff stuck underneath and I can't clean it out. Take a look. These two teeth were taken out. By the time the tissue heals, it is just a rounded mound. In order to cover that mound, our technicians create something called a ridge lap pontic. A pontic from the word pontoon, like a bridge, and ridge lap means that it sits and laps the ridge. Take a look here. This sits over the ridge, but look what's underneath.
Yes.
When you take any bridge off, this is what we find. Absolutely disgusting. And you cannot possibly take a floss and remove that. So seemingly, this area right here looks healed. But the problem is that this is what we find when we remove the old original bridge. And that's why people complain. So what do? Well, there is one way to make a bridge that will actually sit inside the tissue. It's called an ovate pontic. Ova, like an egg. Take a look and compare. The bridge on the right was made for exactly the same space as the one on the left. The one on the right has ovate pontics. They are shaped like an egg. They are perfectly round and perfectly smooth. What happens? The body heals around it. And when I went to school, they used to say that this is actually not good. They used to call it pontic pressure, meaning the bridge was actually pressing on the tissue. What my teachers didn't realize that this is exactly what I want to have happen. I want that pontic to support the tissue. Not only for aesthetic purposes, because then the teeth look like they're coming out of the gum, but also for cleanliness. And this is how you solve the bridge problem. You can even ask my hygienist. She'll tell you that our patients never complain about food getting stuck under the bridge. And I've been doing it like this for over 25 years. Take a look at these two photos. The one on the left shows you the original bridge that I took off. That's the one with all the schmutz underneath. Look at the tissue. It's completely depressed because we lost bone here. The one on the right here is the bridge that I showed you with the ovate pontics. Look how beautiful. We built up the tissue and the gum looks amazing and nothing gets underneath. So if you need a bridge, make sure that you have an ovate pontic made for that site. It can be used with natural teeth as well as with implants. From Prosthodontics and Implant Surgery of Manhattan, where people come in with missing teeth and leave with winning smiles, I am Dr. Zev Kaufman.